Today we have one topic which is very important because practically it's going to make a huge impact, or is already making a huge impact in our health system. Yes, we know, and I just put it in context. The titles is Artificial Intelligence and Healthcare. So, going in that way, it's important to understand a few factors. Technology and healthcare is going linked forever. I mean, 1956, ultrasound made his first appearance. Since then, all the improvement in beyond X-ray, because the X-ray is from the 1895, 1895. In 1895, there was the first data of the X-ray. So then we get 1956 with ultrasound. Then we get in 71 with CT scan, and 77 with MRI. So this is the four components that we main use to detect some disease. And I don't know, thanks to that, and thanks to the person who need to study for this, and only to study, because yes, we are humans. We have a factor that all these pictures they need to be having one interpretation with the less error percent possible, because it's going to depend so many things. I mean, it's going to depend how much will be the diagnostics of the disease. It's going to be how much will be the management, and even if there is the management, how is going to see the progress of the treatment or the therapy they are being using. So, being said this, how this is impacted in 2025? Because since a few years ago we get this artificial intelligence, who 20 years ago we saw only through movies. But the reality is another one. So the reality dictates that nowadays we need the artificial intelligence. It's not that we're going to get less doctors, or we don't need a doctor to tell us what we have. Artificial intelligence still is not capable to have 100% accurate in so many things. And a factor being a doctor is the human part, is the touching, to understand, to examine a person, who until now still the artificial intelligence cannot do. So now, how this can help? So we just have one side, the medical part, or we're going to say the human part. So the human part will be that part when the doctor touches you using the stethoscope, the otoscopy to check your throat, to check your lungs, to check your heart, to touch your abdomen. So the doctor already finished with the clinical examination, and it's supposed to, the doctor is going to understand or have an idea what kind of diagnosis you have. I just say have one idea. You can be super smart as a doctor, having great skill, but you don't have the 100% of the knowledge, and can be some minor mistake. Minor mistake in medicine can be seen as a mistake that doesn't harm the person. And of course, there is so many mistakes that can even cost the life of someone. So how we improve? So we improve in the fact that we need to study more. Medicine is one career that is always need to study. Or what will happen if now we have a tool can be our assistant to assist us. Like the surgeon need the nurse, the instrumentist to help to pass all the instrument to make the operation. Or when we need a person to come to remove blood because the doctor doesn't do. So what we need one assistant. Artificial intelligence have one of the greatest things. So I make one because it's a kind of a lot of things to talk. So I break it in three important topics during this integration between artificial intelligence and the healthcare, or the health system. And this is not only see us as an individual for a doctor, it's his own medical consultation, or as an institute, because I believe there is so many fields that we can use the artificial intelligence. So being said this, put my hand from here. So I break it in quantifiable benefit of AI in the healthcare. I have a real world example so you can cite. We can see this. It's amazing, it's nice, okay? And key arguments for AI importance in the healthcare. So let's start from the beginning. Because I have an important information. So doing my have a discussion with not only ChatGPT, have a discussion also, for example, with the one Grok, with the one in X, and also using the one for Google. So I compare information to see how much is the capacity of knowledge of them. So I found interesting things, okay? So they don't have a real count of like a accountability, how much is in exactly number of knowledge they can have. But for example, everyone is all come together when they say they have 100 of billions on information, based in what? Based in the words that we make it. Okay, so they have, for example, I have a list here, peer review medical literature. So a lot of books is already uploaded to the main of this artificial intelligence. Also on the online publish, the public ones. We have the clinical guidance, the CDC, WHO, and ICE, medical textbooks. I was talking about policy documents, public policies, especially the one for the government. So many case studies, patient education material that they can even create that about this kind of things. We're talking about later now. Everything about the insurance, everything about the public health, bioethics, a lot, okay? So you see, you create like a huge library. Let's put it like this, like a huge library. It's a center of a huge library. So what is coming? So when we're talking about in the first topic about the quantifiable benefit of the AI in healthcare, I found one number important. Look, according to Johns Hopkins, the medical errors cause 250,000 deaths in a year. This is data for the United States, which is a lot. And AI can enter there, helping in what? Diagnosis, protocols, management, education. It's just simple that the doctor should remove the ego and this self-power is like I can manage everything and using artificial intelligence to help more the patient. Based, of course, artificial intelligence is not going to give you if you don't give it. So you given all a right important and right information about all the medical findings and all the medical examination and all the analysis, the pure analysis that is between the patient and the doctor, and this is going to make the artificial intelligence make his using the database and create one algorithm to help you out in the detection, help you out in ways to confirm or give you alternatives, because you can think in one single diagnostic, but there can be a different alternative that you can also think it. That's good. So we have the diagnostic accuracy. Okay, radiologists say the AI detects lung cancer nodules with a sensitivity of 94%. That is a huge percent in medical field. Dermatology AI classifies skin lesions with accuracy comparable to board certificate dermatologists. Amazing. You upload in one picture, they give you this. And nowadays, with the evolution of so many things and the most consumption of chemicals, we get new lesions or looks like lesions. So, ophthalmology, AI can diagnose diabetic retinopathy with 90% accuracy. Wow, that is a huge percent. But that doesn't mean the machine is going to invade us or to like I hear so many people say is going to remove the human part of this medical consultation, but it's not. This is a tool, as a system for a doctor to have a better, I don't know, 2-3 times better diagnosis and management for the patient. Okay. So time saving. AI-assisted documentation can reduce charting time by up to 50%, giving doctors more time with the patient. This is true. Like I told you, after all, you given all to, and they can prepare you everything. So it's like your secretary, your assistant there. So the cost saving. No, look this. It says they say that McKinsey estimate the AI application could save 300 to 400 billions annually in United States healthcare system by improving efficiency and avoiding unnecessary tests or hospitalization. That is correct. We like to use resource when it's not even needed. One person with a problem in the nail, they're going to do it. One CT scan, one full blood count, one biochemical investigation when you don't need it. Or having so many cases. And the engagement, okay? You can use as a pre-system, as like a pre-consultation using AI chatbots, and you can prepare the documentation to see the patient is coming. It's like a formulary. It's very nice. Very nice, and you can even advise based in what they use. So we use it almost every daily now with these customer centers. They have one pre-made questions. looking for the errors or the broken things, we're going to look after assistants, and it's work for them. So the real world examples, we have the IBM Watson for oncology. This analyze patient records and literature to suggest personalized cancer treatment in a study. It provides treatment recommendations consistent with oncology in 93% of breast cancer cases. Huge. Google DeepMind AI in ophthalmology, using OCT scan to detect over 50 eye diseases at expert level accuracy. I need to say more. Sepsis early warning system. This is amazing. This is amazing. It's called Epix AI. Monitor vitals and labs in hospitalized patients. Has been shut down to detect sepsis hours before traditional scoring system. And this is amazing because a lot of people is dying because of the sepsis, because the infection is becoming huge in the body and in the bloodstream, and this can lead to death. Okay, and we have another one. It's called iDoc and Zebra Medical AI Radiology Tools. FDA, okay, approved algorithms that help radiologists identify stroke, fractures, and pulmonary embolisms in imaging faster than manual reads. And this is amazing. The saving time equals to reduction error in the diagnostic by radiologists. It can be better. I mean, you pass so many times and so many hours in the radiologist department because you have appointment and the waiting area is full. Why? Because after seeing the pictures, the radiologist must create a medical report about it. So when we have this radiologist report, the doctor need to focus, need to look at, to see, magnify, we see the minimal details. So with this one, we can say that the doctor can look after the macro and AI after the micro. If you combine these two, the reduction time equal accuracy in the diagnostic is great and is having a huge impact in the health of the patient. Wow. And finally, we have the key arguments, okay? So the argumentation is a no replacement. This is what I say. AI is not to be replaced the doctor. It's just to complementary what the doctor is examination. And all this is to improve the care of the patient. We have the handle exploding data volume. Of course, this is amazing because even if, like I say at the beginning, even if you are the most smart doctor there is no way that you can have all the data in your brain. I mean, all the data. You have access to this. You have data to anything you want to look after and explore. Bridges care gaps. This is true. The bridges care gap is we have this gap doing our knowledge. I am a general practitioner and I supposed to know basic things and advanced things about all kind of fields because I am the first impact in the community or the first encounter in the community between the health system and the patient. Although I don't know everything and I use an AI to help me out with things that I block or things that I know my limit. And that is the part of the ego of the doctor. The doctor should understand that even for more that you want to be smart, you're still a human and you don't know everything. Improves qualities and standardization. This is true. Also, we were talking about before. This is going to make to improve the quality of your consultation, the quality of the life of the patient, and of course it's going to reduce the continuous visit of the patient to the clinic. So even though we improve the health through technology, we can archive, so we can get so many goals in everything, like a reduction in high blood pressure, reduction in diabetes, preventing late phase of cancer, is because also we can use this tool to do a health promotion, health promotion. You can create any kind of picture here. When you give them the right information, they can create so many amazing things doing this. And that is the point. The point of all is we can continue improving our health system. Nowadays, all the consultations have one computer. ChatGPT, Grok, Gemini, for cite some, without being an app, because I believe that we're going to continue having apps and new tools. Everything can be possible. The new evolution of the healthcare system is there. We just need to embrace it and remove the ego. Remove the ego. That's the only thing I always say. You remove the ego, embrace the idea of technology. But I love technology. I use them in my patient and they're improving a lot. So, thank you for watching. I hope you like it. See you soon. Take care.